So hello, everyone. Today you are in for a wildly impactful and enjoyable talk about sex, pelvic floors, all of the things, right? And it's not what you might think it is. So I'm Dan Pacheco, the host of this, and today we are joined by Dr. Kelly Frank. She's a licensed, of course, pelvic health physical therapist, and we also have another doctor, Dr. Leslie Worth, a licensed family therapist and sex therapist. Ladies, thank you so much for agreeing to do this with us today.
Of course.
Yes, excited.
Yeah.
Y'all ready to start to rock, docs?
Let's
Rock and roll.
do this.
Let's do it.
Well, in my sex therapy training, one of the classes was list all the slang words you had for penis and vagina.
Yeah.
And then the professor was like, now do that for your elbow. And he's like, we should just be able to talk about our parts with our parts. Like,
Yeah.
especially on a safety level, if like a kid comes up to you and says, Uncle Joey touched my cookie.
Mm-hmm.
Right.
I don't know what a cookie,
Yeah.
Well, do you find that sometimes also maybe makes it too familiar or too, like, I don't know, we want to normalize it, but we also don't want to make it playful and stuff. Like, oh, you can touch my foofy or whatever it is, right? It's important to take it, health to protect all those things, right?
Right.
So what's the line with that? I mean, or is there one?
So it depends on developmentally. So sometimes I have to help with my parents with that, with the sexual development of a child. Playing doctor, playing house is completely normal. Show me yours, I'll show you mine, because kids are just very curious. If a kid is overly aggressive or really willing to sit on strangers' laps or something like that, that's where we can kind of be like, okay, is there something going on? They're a little too comfortable. But exploration is fine. And a lot of times I have to work with my parents of like not reacting out of shame themselves when they catch them, because then kids are internalizing of like, I'm doing something wrong, or I am bad for, touching my genitals or whatever.
Right.
And then that leads them to not talk about stuff with their parents. So it's like, there's a line.
Yeah.
But I think kids should know their proper body terms. Like, this is elbow, and then, vulva, labia, scrotum. Like, that should just be not any emotion behind those words.
Yeah.
Right.
And I mean, I teach it too from just like going to your pediatrician or your doctor as an adult. And like, if you just walked in and you're just like, my leg hurts. Okay.
Yes.
Like your hip, your thigh, your knee, your ankle, like your toe, like
Which part?
leg is a big part, you know? So if you're like, oh,
my vagina hurts.
My vagina hurts. And then like I try to go inside and they're like, no, the outside. And I'm like, that's the vulva. Like, totally different body part. Like, that was a totally different exam, totally different, maybe even doctor or a different kind of visit. And I see that just with adults too. And it starts with the kids, just, again, just normalizing it and not making a big deal out of it. It's not going to be, my kids will like literally be in like the Disney World bathroom, and they'll describe me what kind of poop they had. At Disney World, they'll describe to me.
It was a soft Mickey pretzel, Mom, I think.
Yeah.
Yes, absolutely. And like I kind of get proud of like other moms and parents are probably hearing that, who are probably like, "Come on, honey, we have to go," and they're rushing it, and my kids are just, like, "Mommy, I had a really big poop. Like it was easy to come out. Like I drank enough water." I'm like, yes.
Yes, they're connecting those dots.
Yeah, and I hope other parents like hear that and they're like, oh, okay, like
it's okay.
This is okay to talk about in a Disney World restroom.
Right.
Yeah, on Main Street.
Exactly. And when it comes to sexual shame, of like, we internalize so much during childhood and then respond to those messaging. So a lot of times with clients, it's like working through of like, where did this messaging come from and how do we kind of deconstruct it so we're not responding to those internal messages that at 5, I'm trying to figure out what my parents were so mad about, right?
Mm-hmm.
As an adult, I'm looking back and it's like, yeah, but you got that memory and that processing at 5. Mm-hmm. And that can be a lot of, I'm a bad person, and a lot of shame to work through.
Yeah.
Sorry. Yeah, I think we're taught that, obviously, just like you said, at an earlier age, it's because sexuality isn't open conversation, at least in the States here. It's very private. You're very private. They're called privates, right? And of course, people should respect, obviously, the body. You have other people's bodies and stuff. But I feel like we never practice, right? We only perform. And when I say that, I mean, to fast track this, in adulthood, when people become sexually active, we're not, again, like you said before when we were warming up here, articulating, talking about what do we want, what's good, what are my boundaries, what are these things,
right?
Yeah.
And it's not just, again, A into B, right? There's many other ways.
Intimacy is much broader.
Right. But again, to your point earlier, we're not practicing it, in quote. We're not talking about it, and so the only time we are, I guess, talking about it, right, is maybe in bed. The only time we're doing it, or again, it's in bed, and so. How do we get better at something without actually practicing it?
Right. And that's where I with sensei focus, that's my angle for it, of like, I describe it as an experiential playground, right? Of it's you and your partner going in, and for you two to learn what touch, as opposed to just like fumbling it by accident, of like really a mindfulness thing. My partner's giving me touch and I'm really engaging of like, do I like this? Is this relaxing? Is this arousing? Is there an order to operations where you can't go straight to the genitals? And a lot of times we do, and it's like our whole body can be an arousing point. So we need to explore all of it. What kind of touch? Do I like light? Do I like firm? Do I like silks? Do I like hands? Like, what do I like? And where do we ever have that in life where we can just go in and experiment without any pressure of like, this has to get to an end goal of performance and sex? I always tell my couples, like, if you come out of it and it's like, it was relaxing, but not sexual, great. If you both come out of it going, I absolutely fucking hated that, excellent, great. Like, this is still, like, this is not meant to get to a result. This is just to give you tools, and then you can use them later as you learn about yourself and about your partner, and normalizing that communication of like, maybe I really don't want my stomach touched because I'm postpartum and I feel self-conscious. How do I gently guide my partner to an area I do feel comfortable with, as opposed to, oh God, no, don't touch me there. And then it's slamming the door shut, and now my partner feels like he did something wrong. And now there's all anxiety and stress and emotions.
Yeah, and I feel like on the sensate focus side, I work a lot with like the desensitization, which, wow, I said that correctly in one take. But it's just, I think a lot of people, they go straight to the genitals, or they go straight to, the end game or whatever it is. When I'm like, if you're starting in a negative because of injury or scar tissue or trauma, stress or tension, and like those muscles are like fighting you, you can't go from negative all the way to positive. And my daughter's in first grade, so we're doing this little number chart. You have to go through 0. You have to go through neutral. So it's like, just touch it, but like, can you feel it? Is it truly numb? Is there injury or,
are you disassociating it from too, like mentally?
Yeah. Then get to neutral, then get to 0.
Right.
Then let's talk about positive numbers. And, 'cause I see so many patients who they want to just get to orgasm. And it's like, we have to just find out what 0 is.
Right. Especially for orgasm for women, of like, you have to fully relax.
Yeah.
And that's where like I work with women. They're like, well, what's orgasm? I'm like, well, if you look at the definition, it's a release. I don't know how to measure a fucking release, right? Like, so it's, but if we have any tension in our body, you're not going to be able to relax. And that's where, when I'm working with sensate, sometimes couples will be frustrated of like, well, it's just relaxing. I'm like, that's a critical point and key that you need to be able to relax into intimacy and arousal and orgasm. Like, we're going from busyness, moving around all day, and now we're going to jump into bed and we're trying to like rush it. And it's like, and I go back to like, what's the point of this?
Yeah.
Is the value of, I want to connect with my partner in a way that I normally don't connect with anyone else. Great.
Yeah.
Let's
hone in on that and remember, like, that's the whole point.
Yeah.
Of this.
Dr. Leslie, let me ask you this. And yes, by the way, we are recording. It is very difficult, ever more difficult to find time in the crazy days, right? And so how do you have a healthy sexual relationship with your partner if you're, again, both in a demanding schedule and you might have to literally schedule sex or intimacy? How do you do it? How do you get into the relaxing state? What's your tip?
Yes. So I usually go back to when they were dating. So before they're living together and they're dating, I'm like, on Monday, you're probably making plans with your partner for Friday. You're looking forward to it. You're cleaning your apartment. You're shaving your legs or whatever. And then the date comes and, go out or whatever, and maybe have sex, maybe not. And I look at them, I'm like, that was scheduling sex. It's just part of the dating culture that we don't see it that way. Now we live with each other, so we think of like it should be easier because we have more access. And then I compare that to having a treadmill in my house doesn't mean I'm going to use it, just having it. Like it's going to turn into a clothes rack, right? I still have to schedule time to actually use the treadmill.
Yeah.
So when it comes to scheduling sex, that's what I want them to hone in on, is like that dating ritual, that time of like, this is when you were sending the flirty texts of like, can't wait to see you, and building up to it, because that's all responsive desire that's getting us into that mindset for intimacy. So it's not just slapping it on the calendar at 8 o'clock on Wednesday as the kids go to bed, but it's like, what are you doing Monday and Tuesday to interact with your partner to get into that moment? So when 8 o'clock on Wednesday comes, you're excited for it, just like you were on that Friday night date when you were dating.
Because, anticipation is a hell of an aphrodisiac.
Oh, yeah.
That's awesome.
Or it's a hell of like a trigger too.
Sure.
So I work a lot, like on my side of it is like kind of like going back to dating, but almost like go back to middle school if we're coming from a place of like tension, and like if like that gentle touch on the knee does not mean sex.
Right.
Like it just means touch on the knee. Kind of like if you were like at the movie theater with like your 8th grade crush and like you just like held hands and like your pinkies touched and it was like
your hand went into the popcorn bucket.
Yeah. And you're like, this is like the highlight of my whole life. Like,
yes.
Like and that was it. Like movie ended, mom picked you up. Like that was it.
Yeah.
Like and that.
But you wrote in your diary about it.
Yeah. For sure. Like lock that up in the way.
Yes.
But it's like, you didn't. So I have patients try to like take all of that, but then also be like, but we don't have to just run the bases real fast. Like we need to like have communication, talk about this, and kind of set not like a limit, but it's just more, again, like you're just getting more comfortable with this and like you're sort of in control, which is
right.
helpful.
And anyone can say no at any point without any punishment.
Yeah.
And part of like the leading up to is like, yes, anticipation, but also like, what am I doing proactively to de-stress, compensate? I always, like with couples with kids, I'm like, yeah, having a pile of laundry on your bed that you have to move is not going to be sexy, right? So I'm a big believer of like your bedroom should kind of be your sex sanctuary in a sense.
Yeah.
I always recommend the Netflix How to Build a Sex Room show. It's amazing of like, how do you make this what you need?
Now, you're not talking about necessarily swings and latex and all those things.
It could
just for
be,
the audience.
Yes. No, it could be just
go you.
I had one couple where like animals, like they love their dogs, they love their pets, but they didn't want them in the room when they're having sex. I'm like, yes, because that's a little awkward to have Fluffy staring at you.
Right.
So I'm like, well, how do you start training them to that they're not always allowed in the bedroom, because having them scratch at the door is going to be distracting too. So sometimes there's steps that we need to do before we get there, but it's looking at that. And then a lot of times people are like, well, that shouldn't bother me. I'm like, we should ourselves a lot.
Yeah.
Like, but if it bothers you and there's an easy fix, like if you like satin sheets, go on Amazon, buy some satin sheets. If it's too cold, I don't know, program your thermostat on at 7 p.m. on Wednesday to start increasing so you're not freezing in the bedroom. Like there's things that we can do proactively to make it easier to transition into it.
I think this is a good way to articulate the point that we are all very sexual beings at some point, right? Not to say, because when you start talking about sex, that taboo comes into play. Well, I'm not a pervert, and all these things, and it sounds like the recommendations you have are fantastic. It does take a lot of thought, though, right? At least to start the patterns, right? And it becomes natural. But it almost sounds like, if you want to maintain an intimate or sexual relationship, right? There's a lot of things like training your pets, setting the thermostat, all these things which make
getting kids to bed,
right, might make some people feel like, oh my gosh, it sounds like I'm centering my entire life around sex. I'm not that kind of person, but I think we are, right? I mean, because like we said, it's not just about penetration,
right?
It could go a long way just to put your hand on your partner's knee or the back of their neck, and wow, that felt good, kind of thing. So maybe both of you can give me give the audience permission in some way, just, what is healthy? What define healthy? What's healthy intimacy? What's healthy sexuality? Those types of things.
For me, healthy is just whatever works for that partnership. So sometimes I'll get people come in, they're like, "Oh, how often should we be having sex a week to be normal?" I'm like, I hate the word normal. And I'm like, I can't put a number on it because there's people out there having sex every single day, but their relationship is not the greatest and they're just going through the motions or they're doing it out of duty. And then I have people out there who have sex once, twice a month, but that's what they want and they're happy. So I'm like, I blame Cosmo Girl. We can't place a number as the barometer of what healthy is. I think healthy is normalizing communication and our needs of what we're needing, because over our lifespan, if we're looking at a long-term relationship, is going to change. The sex we're having in our 20s before children is going to look different than when we have kids, which is going to look different when we're empty nesters, and then perimenopausal and menopause and ED issues, and we're 80, and yes, 80-year-olds still have sex. It just may look different, or I had an injury. So I think for me, healthy is solid communication where both partners are expressing what they're needing in that space and time.
I totally agree. I mean, you touched on we go from 20-something, our lives are different, our bodies are different, our hormones are different. Maybe we have kids, maybe we don't. Maybe we have different kinds of trauma, different kinds of disease, different kinds of things happening. We go through, perimenopause, we go into menopause. And then, all the stress and all the things that we do in life, or just our careers kind of change. Yeah. We all go from, we're super active in high school and college and running around. And now it's we sit for 10 hours a day in a chair that we haven't, replaced since we all started working from home.
And now I worked at home with my partner all the time and I see them all the time. Right. And that's a difference too of what is that, how does that impact the dynamic?
Yeah. But it is, it's healthy sexuality, healthy intimacy is exactly that. It's communication, it's feeling safe, it's, feeling supported, just feeling good. It shouldn't be painful, unless you want it to be, but it shouldn't be painful. And you should just be prepared. Like I said, prepared and supported to kind of go into it. I always
think back to Emily Nagoski, and she always talks about sex is two or more people enthusiastically saying yes, who can say no at any point without punishment. And punishment is not just physical punishment, but guilting. Oh, come on, just do this for me, or any emotional or verbal kind of thing, or guilt trips. I kind of like that definition. It's enthusiastically yes, all parties involved. If that includes, kink and BDSM, awesome. But consenting, everyone is willing to be there, and people can say no at any point.
Yeah.
That's obviously what we would all in this room believe, but that's unfortunately not the case with so many people, right? I think sex culture has become pop culture. Those two things, I think, were born out of the same, year kind of thing, the same place. But both of you, give me some advice on, how people can feel confident in their sexuality, because I think that is beginning to become more and more in the forefront, right? People are no longer afraid to say that, they have an OnlyFans account. They're proud of it, right? People are proud of, saying, what, I believe that I am not this gender that I was born with. I am, something different. These are things that we're asserting. Tell me how they find you all, your place in their confidence. How do you work with those types of people?
So I always, when I work with clients, it's there's no one box fit all for therapy. It's all individualized, and a lot of it I start with deconstructing the messages that were put on us. Emily Nagoski uses this metaphor as a garden of during childhood and development, people have planted these things in your garden, and now as an adult it's up to you to do you want to remove a whole part of it? Do you want to cultivate it? What do you agree with? What do you not agree with? And even coming to a level of acceptance of I may always respond. I have this initial thought to this, but I don't have to let it get into the driver's seat, and I can still be in charge. But really exploring of what is sexuality for you, and that could be, anywhere from I'm asexual, but I can still have intimacy with my partner, or aromantic. There's no one definition. I think that's the hardest thing, because I think as human beings we want that black or white answer, and I'm over here going, it can be anything. It's
chartreuse, cobalt, magenta.
No, I heard a TED talk. I forget who it was, but we always say living in the gray, and they're like, we should be living in the brown because that's all the colors, and it's messy, and sometimes life is shit.
That's very poetic.
So I embrace the brown, and it's like,
good.
it can be messy, but sexuality, even and it's also not static, going back to what we were saying earlier of like, my sexuality in my 20s is probably not going to be what it is when I'm in my 40s.
Yeah.
And how do I not look at it as like written in stone, but that it's this organic thing that's ever evolving because of life experiences, accidents, diseases, traumas, whatever. There's so many variables that we can't even, try to guess them.
Yeah. I feel that way from like the physical therapy, like musculoskeletal side point. It's like we all think we should be either, what we were at peak prime in high school, like the bro who's like, my shoulder hurts, and like, I was the quarterback, and it's like, you're 60 years old, like that shoulder is done, like we have to, your body is aging, like that is like a very natural, healthy process.
Is hard to do in America.
Very hard. Well, because we have the standards, we have the textbooks, we have the guides, we have the influencers, we have the social media, we have
filters.
The neighbor next door who just looks amazing after having her kid. But like, I don't know what kind of life she lives. I don't know what kind of support she has. I don't know if it's all real or if it's all Stepford wives. Like, I have no idea. Right. So it's just, I think the comparison and then allowing any patient, any client to just be like, well, again, like, who are you? Like, what do you like? What don't you like? Like, how do you feel? How does your body react to gravity and just space?
Right.
Like, how can you manipulate that or change that? I think that's where.
And Dr. Kelly, you bring up a really good point there. We're all online, right? And we see these coaches, with whatever credentials, if they have any at all, I don't know, right? And they're claiming they can help you with your, sex drive or testosterone or estrogen, whatever it may be, and they have the supplements to sell all these things. Talk to me about that, because that is in your face all the time. We can't escape it. It makes us feel like crap sometimes, right? Or that we need, like, oh, I don't have this kind of drive. Something must be wrong with me, right?
Yeah.
I'm dead down there. No.
No, people say that.
But, Dr. Kelly, talk about that, and I want to hear what you say as well.
Yeah. So, I mean, we see it online, and it's 100% in our faces all the time. It's walking on the street, it's looking at our phones, and just, I think, like, sure, some of it can certainly be helpful, and if it resonates with you, if it makes you feel good about yourself, or you do find, like, joy, or you're able to take something that, like, you're not just, like, buying all the things and, like, this one influencer or this one coach or this one whoever you are is gonna, like, fix you.
Right.
Like, I don't believe that. Like, I'm, maybe not going to be the only one that helps you, and that's okay. Because like, I need you. Like, I need other doctors. I need other types of therapy. I need other kinds of modalities. Like, I don't think that any one person can fix any one person. Like, it has to be a team approach. It has to be coming from all angles.
Oh, absolutely. The team effort, and we always say, like, we work within our scope, and no one can be an expert on everything.
Yeah.
I might know a little bit of some things, but I'm not going to really know. And I with clients, I just tell them, I'm like, there's no easy button, but it can get easier when we get the tools, and we have to figure out the scheduling and all that stuff. Like, it's a lot of work up front, but once we get there, it gets easier. And there is no simple fix, and when people are trying to say this is the wonder drug or this is going to fix it, I'm just wary, because nothing in life is just that simple.
Well, how can everyone, like, you're the guy, like, you created this, like, wonder drug?
Right.
Like, that's crazy. Like, how are we all not fixed? You know what I mean? Like, it just begs that question of, like, wow, if you're the person who figured this out, like, your 12-step program, your this pill, coated in gold or whatever it is, like, why aren't we all better?
Right.
Yeah. Like,
and
if it was just that simple.
There's just too many variables, and that might work for that person, and then that's great. And this is where we go back to, like, individualize, like, what's going to work for you. And if you look at the leading experts, like Emily Nagoski, at least for female sexuality, her messaging is just like, you have to figure out you.
Yeah.
It's not a one size fits all. I always go back to the diet pill. If the diet pill worked, all of us...
Right. We wouldn't have 25 diets.
Right.
Yeah, we wouldn't have 25 diets.
At first it was Atkins, and then it was South Beach, and then, it's like... And all those work for some times, but... And
or
for
at
some
different
people...
parts in your life.
Right.
Yeah. So like the same thing may or may not work always. And especially as our bodies do change, which is a normal part of just growing up and aging.
Right.
But then you have to seek out different providers or different treatments or different therapies or different modalities or different ways of even looking at how you strength train or relax or, exercise.
Absolutely. Yeah, no, that's where I think one thing that maybe you can boil it down to that could be helpful is awareness.
Yeah.
Are you aware of what's going on? Are you always checking in with self? So if someone wants a one-word answer, I guess it's awareness, but that's a loaded answer because there's a lot that goes into that.
Yeah, I like that.
Yeah, and it's, I think let's take a few steps back right now, okay? So let's go back to stigmas. Let's go back to how things feel when we say them, For a lot of people, I know sex, just that 3-letter word, makes them clutch their pearls sometimes, or they have a reaction to it, right? Vulva, penis, scrotum, labia, those types, all those words make people do the same thing. Oh, yeah, they're like, right? And all of a sudden we start feeling weird about our parts. We don't talk about it. And again, so there's a lot of internal, a monologue in our head, dialogue, if you're like me, right? I talk to myself a bit. But we don't have answers. There's no doctor in my head, right? Yeah. So maybe a good question is, can you define, really what being a pelvic health physical therapist is like, right? A licensed family therapist and a sex therapist, right? Family and sex might even, make some people go, oh my gosh, I'm one of those people kind of thing, right? But it's part of literally the start of life, natural. It's so much of a foundation, literally in all of us. So could you define really what it is that each of you do singularly, and then kind of tell us like this, when do I need it? When would I need to talk to either of you? When, again, I'm not working out like I did when I was in high school or well before then, tell me who.
Yeah. Okay. So pelvic floor or pelvic health physical therapy, it's kind of a little bit of everything. I think it's, people do think about the pelvic floor and they think of this little bowl of muscles that does sit at the bottom of your pelvis, which everyone has a pelvis, by the way, so we can all have.
Even me?
Even you. Wow. We can have pelvic floor dysfunction. But then it just extends, like I think our favorite analogy is like, it's like a house, and this is just the floor. So we have our sidewalls, we have our roof. If you live in Florida on the coast, you have your stilts. You have so much that's kind of going on here. And so we are looking, I have to look at, maybe it's the child who they're constipated and now I'm meeting them when they're in college and now they're constipated. And like, guess what? You've still been constipated since you were 2 and you just dealt with it the way that your family knew how to deal with it, or you just didn't tell anybody and you just been living this way.
No, wait a minute. You're saying things like constipation that has nothing to do with sex, right? So it's not just sex, is it?
Where does like the bowel live next to?
I guess
like it lives next to like the vagina.
Yeah, absolutely.
And if it's anal play, I mean, there you go. Like it's right there. And so you have like the bowel. You have the vagina, you have the bladder. The pelvic floor muscles are basically like, the security guards, like I'm gonna let you in or I'm not gonna let you in, and then, if you have a bunch of poop in there and then you have some kind of thrusting, or even if you're just doing any kind of like core thing, like a whole big pile of like shit in your abdomen, it's gonna hurt. It's gonna then push on other organs and make you feel a certain way. Or if you are, leaking, like incontinence, I think a lot of people think of pelvic health physical therapy as like just incontinence, like little old ladies, like diapers.
Or right after childbirth.
And it's like, again, like, is that, incontinence related to the constipation or the bowel habits, any kind of tension, any kind of like disease processes, which can like range from like, there's just so much there. And then even just like, our postures and like our hip strength and like the muscles that are actually kind of supposed to be doing the job. You know what I mean? Like if like my butt is like my glutes are supposed to help me stand or kind of walk, but then I'm like leading with my chest, or I'm like curling over here with my side, or I'm just sitting here and like so anxious that like I'm just like squeezing my butt, which like I feel like everybody right now
are squeezing our butts.
Can you like let your like butt go? Like,
or they even have the awareness of how to.
I literally just did that and I felt amazing. That
so can you even kind of like, yeah.
Because so many people talk about lower back pain.
Yeah, or you have low back pain. I mean, you have shoulder pain. It's all.
I remember you telling me one part. You can watch someone walk and you can tell me if you can tell if they have pelvic floor.
Yeah. Oh yeah.
Just from how they walk.
Absolutely. So it's
probably if they're wearing skinny jeans, it helps out too. You can see more, right?
Well, you can see more, and then that hurts more because then we're just compressing all the nerves. So we just talked about the muscles and some organs, but then like our nerves are affected, and like our skin is affected, and then like we go back to like, you know, Cosmo Girl or whoever, and like, you know, even just like our moms, like how you're supposed to stand, how you're supposed to sit, how you're supposed to act.
Pull your shoulders back.
You know, and like if that's not comfortable, if you can't just sit here and kind of jello out, you know, when you're comfortable talking with a friend, it's, you know, you're kind of sitting here super on and like it's going to kind of turn your whole body against you. So
I think you're getting that pelvic health is for everyone.
It's for everyone.
At any age.
At any age.
Incredible.
And it's most of the time, you know, we do see patients who they have a problem and they want you to fix it. And then I have to like go backwards, you know, down this rabbit hole of like, oh, okay, so this happened then, this is happening now, this is, you know, what you've gone through. But then I do see some patients who don't want pelvic floor problems. You know, I have patients who are starting like a fertility journey and they're like, listen, I don't want to pee my pants like my mom, or I just don't want these things. They are more proactive. But again, I think it's I don't want to say this, sounds like really weird, but like not like desperate people, but like hurt people, just people that have
once it becomes a problem. That's when, and that's same
they
with,
don't know like what to do, so then they like went on social media and someone, which is great. I love that pelvic floor is trending. I love that for my job. But, you know, again, you go down these like different rabbit holes and, you know, if you don't meet the correct provider or the provider that really just wants, I want my patients to help themselves. Like, I don't want to be a part of this journey forever. I will be kind of like theoretically and like,
I always joke, I'm like, it's my job to work myself out of a job.
Yes.
With you.
Love that.
Yeah. So it's like, I want them to, you know, like I have patients who will kind of like reach out to me, message me like, hey, this is happening now because now I did have my kid, or now I am in a new relationship, or now I am going through perimenopause. You know, now I'm having this problem. Before I had a completely different problem. You know,
and they already have that relationship, so they feel comfortable reaching out.
Yeah.
And same with sex therapy. It's its own entity, but I really feel like it should just be part of mental health in general. And I much rather work with a couple who's coming in of like very fresh into their relationship. There's not a lot of problems. They're just like, we want better communication skills, and we're just, you know, maybe we're inexperienced sexually. We just want to. I'm like, yeah, that's great. Versus, and I work with them, but the couples who this started 20 years ago, and now before we even touch potentially the intimacy problem, I have to work through all that potential resentment and emotional baggage that came along with it, and a lot of times with my clients, I use a lot of humor because once they come to me, it's a serious problem. We have to fix it. You know, my sex life is over. My partner's mad at me, or whatever. And it's going back to of like, we need to engage in playfulness. Like we call them sex toys.
Yeah.
You're supposed to be playful, you know, and how do we get back to that? And also like that also helps because if I'm looking at a very serious problem, I'm tense, I'm anxious, I'm like, and that works against being able to relax and get into that vulnerable state and learn to trust my partner and just ease into it. So when it comes to sex therapy, yes, it's working with couples who have intimacy issues, but I also see it as educational pieces of like, how do I help parents talk to their kids about sexual development? What's normal? Like, you know, my kid was playing doctor with their friend when they're 5. I'm like, that's pretty normal. They're very curious. They're just going to be exploring their bodies. You don't have to react harshly, you know, keep an eye on it, but that's normal development of what's going on at that age. Yeah. So I think both of us are kind of get to of like anytime any person, and it's a holistic view, like people come in and their sex life is a problem and I'm asking about work and they're like, why? I'm like, because our sex lives don't exist in like in a cubby over here. Like everything is, you know, if work is stressful or if you have like an injury, like it's all interconnected. It's like a spider web, and we're focusing on this one part, but what else is connecting to that could be a problem?
Yeah.
And that's one of those things too, again, where I feel like so many people live inside their heads. They don't talk about it, right? Could you give me, like, I mean, it's definitely putting you on the spot here, but maybe a general percentage, right, of how many straight men enjoy anal play, right, on themselves, right? How many couples or individuals of, no matter what gender identity they have, use sex toys on themselves, right? I mean, those are things that I feel like, again, most people would say, well, that's like, I'm not that kind of guy, right?
Yeah.
But a lot of them are out there, kind of closeted. They don't talk about it. So do you have any kind of reports on that?
I don't really have statistics, but I always go back to what sent me to the ER.
Yeah.
And I'm like, how many shampoo bottles, whatever has been inserted? And that's where it's just like, I wish it was more normalized, because it's like you need to have toys that are designed to go into the anus, because you can really cause damage if you're using something that is not meant to go up there. And I also tell the guys of like, the prostate is a pleasurable sensation, and like it doesn't, whatever it is, it's like it's okay. And I think it's breaking those myths of like sexuality is just enjoying your body, and if we can break the stigmas of just like what we're supposed to do.
Yeah.
I joke with my guys of I get a lot of men for like erectile dysfunction, and I always say, I'm like, if I thought you would show up, I would run a group so all of you would know you're not alone, but I know none of you would show up.
No.
These are my brothers. Yes. We're talking about this.
Yes, we're all kind of talking about our erections and our problems. And I say that because like I have enough to be running a group consistently of men who are ashamed that their penises aren't working the way that they want them.
Yeah, and it could be due to like those tight pelvic floor muscles. It could be due to prostate issues. It could be due to weak pelvic floor muscles or a weak core, or just another fun word we say is like oh my gosh, I'm not gonna say that right. Dyssynergia, like dyssynergy. Just not, this is not talking to this, and it's just kind of missing one another.
Well, and that's the thing right now too that's really hot. You have the brands like Hims, right, or whatever, or even hers too, but yeah, I bring this up because the erectile dysfunction pills, right? They've become very popular. They've become even recreational.
Yes.
Right?
Yeah.
So guys will take them out, and like they don't even have a date lined up or anything. They're just like, I'm going out tonight and I'm planning on it.
Yes.
I'm scheduling it, right?
Yes.
So I say that because, again, it's no longer just those guys that are having a hard time chronically. Right. Is that something that we celebrate? Is that something that we say, ooh, you're actually damaging yourself? Because I feel like when you have a pill for something, there could be more holistic things, like you said, pelvic floor exercises, things like that, eliminating too much caffeine. What's the stress levels like in your life? Kind of finish the sentence there, fill in the blanks there for me. Are we pro, again, recreational erectile pills? Or where do we stand on this, ladies?
I think as long as people are being careful, right? And it's their choice and it's their bodies, with it. And when it comes to especially erectile dysfunction, a lot of the times, if we're talking about someone who has truly ED issues, they'll take the pill and they're wondering why their partner doesn't want to engage with them. I'm like, because we're not focusing on the emotional piece. It's not just the mechanics.
Don't you see it?
Right. Yeah. But it is an educational piece too, of just, because I have younger guys with ED, actually, alcohol, whiskey dick. I'm sure we've heard of that. Yeah. That term. But also with guys, there was a study, I forget exactly the numbers, but they were showing of like younger men having erectile dysfunction due to the amount of porn they were watching, because porn is not what we're dealing with in real life. Right. Or they have really rigid masturbation practices that, like, I tell my guys, I'm like, your hand grip, the vagina can't compete. Like,
interesting.
No matter how tight the pelvic floor muscles are.
Well, and even then you have a problem on the other side.
Right. Then
if it's
painful.
That tight, then it's like she has the problem or they have their problem, and like that's not going to be helpful.
If you want to do it recreationally, it's like I'm always saying, like, talk to a doctor. Anytime you're doing medication and dealing with stuff, you want to make sure you're not having any issues with other medications you're taking, especially if if you're on a stimulant or something like that. Like, you want to make sure you're not going to have complications.
Well, yeah, because it's really what it does. It doesn't just a little wizard doesn't come out with a little magical wand and go,
no,
there you go.
Yeah.
Right?
It's all blood flow.
It's blood flow. It's a vasodilator, correct? Yeah, and so that can lead to headaches, if you have things, aneurysms or things like, I don't know, I'm just kind of
also,
spitballing.
But also of if it's not going away after the 4 hours or whatever the time is, you need to go to a physician because the blood can coagulate or whatever in there, and then you have to get it drained with a needle. So
talk about kink.
They're like, and this is where I'm like, okay, you can get it online, that kind of stuff, but you want to make sure you're getting the actual thing. You're talking to a doctor. You're not just getting something that is saying it is what it is without.
This too, though, it's very easy to get any kind of medication, especially with teledoctors.
Oh, for sure.
Right? I mean, I could literally Google how to get Adderall, how to get ED pills, how to get any pill that I want, basically. And if I'm speaking to a teledoctor, it's going to last maybe 5 minutes, the actual consultation.
Yeah.
Right? And I already know my list of yeses and nos.
Yes.
Right? So that's dangerous.
Yeah.
Is it or not?
It is. And then we're not finding out like the why.
Right.
Like, why do you have this problem? Like, why is something working too well or not working well enough?
Or what is our definition of working well? Like, I like with my guys, they watching like a porn compilation or porn actors are using numbing agents or whatever or pills to last longer, and that's where I do education. I'm like, penetrative sex, thrusting into any orifice, whatever it is, on average until ejaculation, 3 to 7 minutes. That's it.
All right, all right. I feel all right.
So when guys are like, I'm not lasting hours, or 11, they're like, I'm premature, and I'm like, what is premature to you? Because the definition in the DSM is like less than a minute of penetration. And they're like, not lasting hours or that kind of stuff. And I'm like, 3 to 7 minutes. Yes, you can buy time because guys can know, they can build the tolerance of know where like they're getting close, and then they can, change positions or whatever. But if we're just doing thrusting, penetrative sex, average 3 to 7 minutes until ejaculation.
Not to mention that 45-minute porn video, they use the magic of Hollywood. There's probably several takes in there,
bucko. Changing out, especially the compilations. I go back and I'm like, watch, is it the same person? Or are they changing, like they're going from oral sex to a manual stimulation to maybe anal to whatever. Like, are they switching?
Right.
Because that's also going to potentially buy you time. But a lot of my guys look at me and they're like, really? I'm like, yeah, that's
And I think they're essentially comparing themselves too. It's not so much about their fantasy or what they would want. I mean, likely part of it, right?
Yes.
And every kink or every preference comes from some place. But there's also that inherent subconscious comparison. Oh, I don't have that piece of equipment like that, right? Or mine doesn't work that way, or these things. And I think that, again, destroys a little bit of the individual, not just their ability to have relationships or a good, healthy, sexual relationship, trying to live up to those standards. It also breaks down the individual.
Yeah, especially, and we talk about men comparing themselves, but women too, of like, how many labiaplasties are women doing because their labia doesn't look normal, and it's like,
and that's gonna change down there.
It's gonna change. When it's also like
happens.
that's so like in development, like until the estrogen or testosterone and fetal development happens, like it's all the same parts, like, and the labia has erection tissue in it that gets puffy and that stuff during sex, and you can risk losing those sensations if you're doing the cosmetic. Like, now, yes, there's definitely women where they need the surgery because it's uncomfortable and it's causing discomfort, but women are also looking at those, images of like, what is it supposed to look like down there? Like pubic hair is normal.
Yeah. It serves purpose.
Right. Yeah. It's not just a little additional. Yeah, it's functional.
It's functional.
Yeah. So maybe let's get into this. I really feel like we could have literally an entire series of this, and I am throwing my hat in the ring. I would love to be a third in this dialogue here.
Perfect.
I'm going to say dialogue because we're the context we're talking about here. But with the idea of again, just comparing my body to the trends, right? What are some trends that we're seeing in sexuality? Or even just in the pelvic floor realm, because it's not, like you said, it's not just sex, right? It's not just intimacy. There's many things too. And, I see gym selfies of these tights that are pulled up and horrible, like just, geez, Louise, my friend, but it's trending, right? Doing certain things are trending. Talk to me about, what's trending and what should we stop letting trend? Just off the top of your heads?
I mean, I think not even like a trend, but just like maybe like the American thing, which is like more is better.
Yes.
Like the most I can do, or like the biggest I can be, or the fastest I can run, or just we're America, number one.
Yes.
Right? Like just that.
And actually, I don't mean to interrupt, but this just hit my head, and this is something that I'm genuinely curious about. Do BBLs negatively impact the pelvic floor? Like the big fake butts? Putting all those things in them, I have to imagine that throws
how you
the
sit.
body off, how you sit.
I personally have never had a patient that I've known that has like a fake one. I mean, again, like get your mommy makeover if you want, like whatever makes you happy.
Right. And this isn't shaming or anything. This is just
it would
curious
100%.
because it's trending like a lot.
I don't see how it would not. I mean, you're
changing the anatomy.
You're changing the anatomy. You're changing your dimensions. I see it with patients who do go through weight changes, or they do have the surgeries, right? They have like the gastric sleeve, they take away the excess skin, and like you're so used to living in this space where you were here or whatever, and now you're here, and you really, when you take away skin or you add skin, like again, the nervous structure, the ligament structure, all the soft tissue underneath is gonna change. And then, like the glute is a really important muscle. So then to add something fake on top, like it won't actually give you more strength to do a sit to stand, but it really might impact like your tailbone, like your coccyx, like it might impact the hip structure. It might impact how your knees are when you're standing, which is going to then affect the inner thighs, the pelvic floor. It could affect how you poop, I would imagine. Like if you don't have feeling, because maybe I don't know if they numb it. I honestly don't know much about that specific surgery, but if they like numb it, then like if your anus like is just kind of like hanging out there, and like, do we hold this poop? Do we let this poop go? Like, do we let this fart go? Is it a fart? Is it liquid? Is it solid? Like that's the role of that sphincter. So I'm like, I would, and I don't know, maybe it doesn't affect people.
Sure.
Maybe they go a different way, but I think it definitely would affect how you sit, how you stand.
And I'm sure there's no pamphlet they get sent home with, like, here's how you take care of your BBL, your big,
probably not.
Just like,
probably not.
Just stay out of there for 2 weeks, but ice it, and then get back into it. Yeah,
because I mean, that's a surgery, right? So I mean, I look at it as like physical therapy in general is just you usually get it after a knee, after a shoulder, after a hip, and it's very commonplace. Everybody's on board. But then you have a baby, then you go through menopause, then you have, any kind of like prosthetic surgery or something. Like that was a procedure you had done. Like you should probably take the next step and make sure either it doesn't happen again, or you kind of fix, you just fix the structure that you have.
Or relearn how to maneuver in your body.
Yeah. Yeah,
sure.
And Dr. Leslie, what are some trends, to get back to it? Sorry, I threw in the BBL thing.
It's something to look into.
I'm like wildly curious now.
Have them, and
I must be watching the wrong like reels and trends.
Listen, my algorithm is clean. I always think that if you really want to see who a person is, go for their For You page on there and see what do they really. I'll probably show you mine. They're cats, raccoons, Hyraxes, and tattoos. And that's all. Right, I'm a good person. I'm telling you, y'all, I'm not a freaking that way.
But now our Instagrams and TikToks are going to be covered with like nonsense
all
now.
butts now.
Yeah.
But Dr. Leslie, tell me some of the things that you see that are trending or should stop trending.
What's trending is more ethical non-monogamy in relationship structures, which more power to you, whatever. But that comes with a lot more need for communication.
Can you say that again? So. Like, I have no idea.
Ethical non-monogamy, polyamory.
That is like
ethical
such a
non-monogamy. So let me ask you, why non-monogamy versus polygamy?
So some people like polyamory. Some people like E&M's, ethical non-monogamy. It's all the same. Some people just prefer different terms.
Sounds better.
Yeah.
It sounds, because polygamy, you start to think of, just bad connotations oftentimes.
Right.
So non-monogamy, it sounds like something we can all get around.
Yeah. And I like the ethical part too, because it's like, this is not, and people with E&M's, ethical non-monogamy, there are boundaries, there's agreements. It's not just unless your agreement's a free-for-all, but it's, I compare when I work with E&M's of, when you're in a monogamous relationship, it's like buying a house. The number of bedrooms might be different, but I know it's probably going to have a kitchen and a bathroom and that kind of stuff. E&M's is like buying a plot of land. we want to make sure we're building the same thing. Are we building a bungalow? Are we building, a castle? Like, we don't want to get down the road.
Suite? No.
Yeah. Right. Are we getting down the road and we're realizing we're not building the same thing? Mm-hmm. So that's trending. And with it, it's like, I think it's great because it goes to, I think even for sexuality pieces, of maybe I get along with my partner so well and we worked well together, but maybe he's not into the kink that I'm into, and I don't have to cut that off, but I can explore this in a different area. I break it down of like, we do that all the time. Like if my husband's into football and I hate sports, go with your buddy to the football game. Yeah. That's fine. But once it gets to sex, it's like, well, then there's something wrong with me. And it's like, it's a need. And if we can get to the point where it is acceptable and people are comfortable with it, which is a lot of work in itself, and seeing it of like, sex acts are not tied to my self-worth. Like, I don't think anything less of myself if I don't like football.
Right.
I think better of myself. But but if my partner, wants different types of sex act or something like that, all of a sudden, like, I'm lacking. There's something wrong with me versus of like, there's just a difference and that's okay. So I think that's a trend that is actually probably helping people. Also, their communication is improving because the more partners you add in, you have to have more communication unless it's going to just explode.
Now, how do you approach that? Because, I mean, I'm thinking back to partners I've had, right? And I'm like, serious ones. And I'm like, I would never in my life think that, hey, listen, I know you're not really into this. What would you think if I found someone else or we found somebody else for me to do this with? I feel like I would need to go into witness protection almost, right? So, I mean, and I mean, seriously speaking, do you recommend that to be something that is talked about in a professional and helpful setting, such as going with you?
Yeah.
And if not, how would you recommend to approach that under your own roof?
So younger generations, it's just becoming more acceptable.
Yeah.
I've definitely had people where they saw the idea, they jumped too quickly, it blew up, and now they're coming and they're like, okay, do we actually want to do this? How do we protect the most we can without it exploding? And I've suggested it to older couples. There's one couple that comes to mind where the female partner just was not sexual anymore due to health issues and accidents, but they've been together for like 40 something years and he was still sexual, and I go like, why does this have to be the end of the marriage? It took a while to get there, but it's just like, you guys have a life together, you have kids, you have grandkids, you get along, he's taking care of you, but he can't turn himself off his needs either. I think of Esther Perel's State of Affairs of the person in society. People in society will usually go to the person who doesn't want to have sex and be like, well, don't do what you don't want to do. Mm-hmm. Absolutely. But then you're forcing the other person to force celibacy, and that's not any better. So we want to look at, like, where is the middle ground? If there is a middle ground, and if not, can we get creative? And I tell people, I'm like, can we negotiate? Can we change? Our lives aren't static. So the vows we made 30 years ago and in health and sickness, sure, but like how that looks may look very different. And can we renegotiate where those boundaries are, where the 92% can stay and we can get the 8% met somewhere else? Mm-hmm.
I feel like that's such a new way of thinking, And
it is.
I'm starting to see it more though too. I definitely see it more in my practice where, again, you have to like kind of, you're talking to these people and then they kind of say, oh yeah, and by the way, like, this is, my wife, but this is also my other partner. And then I have this planned or whatever. And it's like, you have to just, great. Like, are you happy? Like, like what's going on? Like, and then what issues are we having now? Like, again, with a new partner or, with what you're trying to do with yourself.
Right.
Mm-hmm.
That's so fascinating. It really is. Because would you say that our sexuality is such a huge part of our identity? And I'll set this up. Okay. So when we meet each other at a BNI or a mixer or a party, whatever it is, right? The first thing we do when someone asks, so tell me about yourself. Well, I'm Dan, I'm a video producer, I've got 2 daughters, and that's we all say that,
right?
Mm-hmm. And that's, we inherently make those things a part of our identity, which they're vastly not, right? What I do for a living is not my identity, right? Mm-hmm. Sexuality, though, very much is, but we don't talk about that,
right?
Right.
Mm-hmm. And that's and I wish more people do. And that's where I work with clients. I'm like, if every person I meet with goes and can talk to their friends and family about sexuality, I'm like, I'm doing my job of like spreading it, because, and when it comes to sexuality too, it's I've had female clients that come in of like, am I asexual or do I not like sex because it's painful? I'm like, solid question. If you're ace, there's nothing wrong with that. You know, the sexuality spectrum is very wide, but are you just going down that road and accepting that part of you because there's something going on with the pelvic floor, and if we got some techniques, maybe it's not painful, and then our body's not trying to just protect itself all the time, and we can explore that part of the sexuality. And our sexuality is always ever changing over our lifestyle. So even if we don't like sex or actively wanting to have penetrative sex, that's not what sexuality is. Sexuality is how I kind of see it's like how we interact with other people and the type of relationships we have. And from a biological stance, you know, is there that drive to keep the species going? You know, it's a really complex answer to a simple question.
Well, would you say that our sexuality kind of shows up inadvertently? I mean, you being someone you're a doctor in this, right? Mm-hmm. You know, just much like Dr. Kelly, you know, could look at somebody and see you've probably got some pelvic things going on right now. Can you look at someone and or observe someone rather, the way they interact, the way they speak, you know, with other people, and kind of get a vibe of, you know, they have suppressed sexuality? Are there someone that's more open? Like, is there anything there as far as that goes? And
a lot of it's just like how open you are. You know, it's like I joke sometimes. It's like if I'm out with friends or whatever, you know, I talk about sex all day, every day, you know? So like, it doesn't bother me, you know, like I was the one that told my stepkid what 69 meant because her mom like freaked out. And I'm like, let me draw a stick figure, or like, this is what it is. There's nothing to it. Right. So just from interactions with that, I can just like, I don't know their sexuality, but I can probably gauge their comfort level with just talking about sex, you know, of like, my parents are just now getting to the point of saying I do sex therapy sometimes with people. You know, I was a therapist, but you know, it's, you know, it's
what kind of he's one of the
you know, and so watching people interact, like, you know, with that kind of thing, sometimes you can pick up of just like their comfort level of talking about intimacy, or even just you like talking about pelvic health, you know?
Yeah. I feel like it's also like I deal a lot with like, and I'm sure you do too, with like what's common versus like what's normal. Yeah. And so we kind of think, you know, we should be having sex this way because this is common, this is what everybody does. But then like, is it normal to have pain? Is it normal to like pee myself? Is it normal to have this like really horrible pain in my abdomen? You know, like what's normal for you is not normal for someone else.
Right.
What your baseline is or what you're kind of capable of. But then also like, just because something is like common or we see it out in public or we talk
like
about,
porn all the time. Yeah. I'm like, the angle that's good for the camera is probably not good for pleasure.
Good point. That's a good point.
You know, like it's just... Yeah, and maybe, but it's like we want to go back to Emily Nagowski. I get a lot from her too of just like we want to focus on pleasure. Yeah, and if it's pleasurable, and same with pain. Like there's a lot of women of just like, you know, it's just painful and that's just what it is, and it's like it shouldn't be. Right. Yeah. You know, it should not be. Unless we're talking about like kink BDSM pain, but like just penetration or touching the outer, like the labia or whatever. Like if there's pain. Normal state of body should not be in pain.
No.
Right.
And I think that's the crazy thing is like if going back to like if my foot was hurting, I would go to the doctor, you know, or if my neck was hurting. But then we just accept like, oh, if my genitals hurt, I guess it's okay. And I'm like, where did that come from?
Yeah, and we accept it for decades. Because like I mean, I do meet these people soon, but usually it is after like 5-10 years of some kind of dysfunction, and they're like, well, this is just how my body is, like this is just kind of like what it's done since, you know, we can kind of like trace it back to some event or some change or something. But then I'm like, oh, you didn't think that was like kind of weird, or like there was
like
a huge
pain
shift?
Is like our way our body and our attention, like something's wrong.
Right. Yeah. That's biologically correct.
Yeah. You know.
Yeah.
So,
or if you do like have sex for the first time and it is painful, then you assume that all of this is going to always be painful, and then that just kind of stems. So if you do ever have a new partner, or if you do kind of stay with that same partner, it just changes the whole dynamic of everything, because you have no idea what's normal.
Right. And that goes back to going common or normal of part of like when we're working with a couple of like, especially if there's vaginismus or something going on, and I'm talking to a couple about positions, I'm like, there is geometry going on. Curvature of the penis, curvature of the vaginal canal, how deep is the vaginal canal. So I'm always like, practice and play with different positions, because what's common, missionary or whatever, may not be what you need based on geometry of the parts.
Now, with that, Dr. Leslie, when someone comes in with you and is working with you, you're working with them on the emotional thing, redefining, what the definitions of these things are. Are you also helping them, obviously, like guide them or show them a chart, practice with stuffed animals? I don't know what you do, but are you helping them, find those types of positions?
Yeah, and giving them resources too, and educating. It's like, you might need a wedge pillow. You might need something to kind of bolster you up, and that's fine. And just of this, and also going back to like age and all that stuff of like, the sex you had when you were 20 probably not going to be. It's okay to use, whatever you need. Props or cushions and that kind of stuff, and education. So like, it's sometimes I'll even tell them like, watch some ethical porn. I like, Make Love Not Porn, which is just people uploading their own stuff.
Yeah, I mean, there are alternatives out there that are much softer, that are respectful, that are more, again, like normal, not Hollywood.
It's like
crazy.
Looking at two real people, not a crafted scene.
Right.
Of what it is.
A pizza boy and a, stepmom or something.
But just to just see, and that's where the communication is so important, because I'll be like, you if you grit through something, if you just like, okay, I'm just gonna get through this, all you're doing is strengthening that negative connotation of like, we don't like this, so the next time it's even being harder. So it's like, if something is not comfortable, just like if on a car road trip, all of a sudden, if I'm just like, I need to stand up, can we pull over? I need to stretch my back. It should be as simple as that, of just going like, my leg is cramping. Can I change positions? Or like, my back is hurting. It shouldn't.
Right.
People are afraid it's going to interrupt the flow, but it's like, if we normalize communication, it's not going to interrupt the flow, and we want both partners to feel comfortable of what's going on.
Well, it's also like back to that like American, like, we're first, we're the best, we're the most, we're. And then it's also like, but nothing bothers me. Like, I am gonna grit through it, or I'm gonna just, I hate this so much, but I'm gonna do it because I have to, or because so and so is like relying on me, depending on me, or I just don't want to show that I'm weak, or I'm whatever emotion I am. It's we don't want to show that.
Right. And it's going to like, sex is, in my opinion, the most vulnerable we can be with someone. And if we're engaging in sex, we should be able to speak our mind and be vulnerable about the whole process.
Much more than just physical. It really is emotional. I mean, and its communication is paramount in that. I think we're touching on something really cool here. So maybe just kind of rapid fire, without going too much into detail, just kind of bullet point, a few misconceptions that each of you face. Could be, popular FAQs from your clientele, or just things that you observe that are just misconceptions of, pelvic floor health and sexuality, sexual health.
I think that the pelvic floor is not just the only thing that we look at. It's truly looking at the whole person from head to toe. How you go through life is how we fix you.
Yeah, sex therapy. I don't have sex with my clients, so I'm not a sex surrogate. That's a whole different thing.
Different job title.
Different job title. And then when you come to sex therapy, we're not going to just be talking about in the bedroom. We're going to be talking about the whole body and the whole life experience.
And I think that right there, both of those are once that message is heard, the doors are wide open for so many people that didn't think that they need or they could go to a sex therapist, right? Or they're afraid of, getting a finger up their butt or something like that. With pelvic health. It really is for everybody. And it's not like, I think both of you have mentioned this in multiple ways throughout this chat here. It's not just for when you need it. It's not just for a certain age. Yeah. It really is for pretty much everybody. Yep. And I remember being really young and being very sexually aware of myself at what I would consider to be a very early age. And I think there's need for safe spaces and comfortable questions.
Yes.
Right. For anybody of any age, especially, kind of thing. You were sharing something with me before we hit the record button here of, the Girl Scouts. Are you cool talking to me a little bit about that? Yeah.
Yeah, I mean, I love to teach young people, especially like little girls, just, who are like those like tweens going into puberty, just about themselves. And I mean, obviously we go into like menstruation and period health and puberty, but just that bowel and bladder component, I think that people just really don't think it's a part of pelvic floor, because again, there's pills and juices and
Miralax.
There's things that you can take to like fix those things, but just I think again, like understanding our anatomy in a very basic term. This is just kind of what it is. There isn't a showy name, and then that's going to kind of give you the strength, the empowerment to then ask your doctor, like, hey, this is something I noticed about XYZ part. Or have a conversation with your partner that when you get to that age, I do like this on this part. And it kind of just gives clear, direct communication. Right. And then again, the level of shame or guilt, it tends to go down because you're not talking about something weird and something gross and something disgusting. It's like, no, this is just kind of what I've got going on. 50% of the population, whichever side wherever you live on that, like we all kind of have this anatomy in some form. So just educating them and I think back to like the classes I teach, like I'm doing it more because I grew up really great, but also like I didn't know all these things about my own body until I went through graduate school and into postgraduate school to become specialized in pelvic health. And it just, I'm like, I was like in my like late 20s when I figured this out. And had I known that like having a really painful period is not a positive thing, and that could be a sign of disease, or, not knowing that you shouldn't pee every hour or something like that, it's going to that's going to make a huge impact on like the adults and everything like that. But then you meet a lot of parents who are just like mortified because they grew up at the same level that I did, or maybe even a little bit more, like closed off. And it's like, I am going to say these words, right? I'm going to say the word
it's like you're
vulva.
talking to the kids, but you're also talking to the parents who are just like
and the
standing on the
parents,
perimeter.
I mean, the kids are having fun. Like we decorate cookies and like we learn about anatomy. It's fun. But the parents, like the moms, like they're taking notes. Their eyeballs are big. They're like, I have to ask so many questions, because like.
What about the dads though?
The dads are usually like, what, are we really talking about this? And like, hands in, head in hands. I've had some dads though. So like there have been a couple of dads who've been really awesome because they are the girl dads and they know that this is part of their life. And then some dads are kind of like, oh my gosh, like why are we talking about this? Like you have to teach them the word vulva, or they have to go home and look at it. And it's like, yeah, bro, like...
Because it's not dirty.
Well, it's better than chi-chi, my-cha-cha. I mean, it kind of makes it comic booky, or it devalues it, I think.
Yes. Yeah, it devalues it. When it can be it's such an important part of our everyday
I just remember you telling me about your daughter correcting the doctor, right?
Yes.
Tell me about that. What happened there?
Well, I mean, she's known what we've just always called it. I have a 3.5 and a 6.5-year-old, and girl and boy. So it's like she's been saying vulva, and she knows that like when I'm on my period, like I do place a tampon like into my vagina. Like she knows kind of like that's a different term. And I think that her doctor, it was like one of her visits, which she did. The doctor was amazing, and she asked like, is it okay if if we take off your underwear and we look, I think she said like at vagina, and my daughter goes, you want to look at my vulva? And like, it's like I think she was like maybe 5.5 or 6, and it was just like, yes, again, like just such a big win for me. Right. I mean, it should be a win for
It's just a word. It's just a word, and I think that's like with younger generations, if we can do that, where it's like there is no inherent shame to those words. Right. That's how we can change society. It's like in the societal construct that we're under of just like your 5-year-old was just like, you meant vulva, in a way, and it should be that nonchalant.
Yeah, well, and I look at it too as like, I mean, I feel like all of this comes back to like a developmental stuff, because I'm a parent, so it's like the first year of their lives, like the doctors only asked about how much pee and poop they had. It was the most popular topic. It's the most popular topic on like a mom blog. It's like, my kid pees this or my kid poops that or it's this color or that. You know, it's like we talk about it and then
nothing.
Honestly, when they were going through potty training, nobody asked me about anything. And that's when they get constipated. That's when they get scared. That's when they hold tension or when they change their habits or they start to sit really weird. And then we carry that on through adulthood. That turns into sexual health, maybe reproductive health, and it's going to alter how that, you know, common or normal timeline is supposed to go. And it's like, oh, this isn't working. Well, like, yeah, we kind of just ditched that whole effort at 2 years old.
Right.
And we went a completely different direction because no one wanted to talk about it or someone was scared to talk about it or they didn't know what they were even talking about.
Right, because people go to doctors and hope they're, you know, that's where I try to work with like gynecologists and neurologists. I'm like, you have to ask too, like of when it comes to sexual health, because people are going, they're always, at least in my case, with sexual piece, they're going to go to their doctor first. They're going to go to their gynecologist or primary care first and see if there's a physiological thing. And depending on where that doctor's knowledge is, they may not be asking the needed questions. Like in my intake, even if you're just coming for anxiety or depression, in my intake forms, I'm asking about sexual health. I'm asking if you're satisfied. I'm asking what's going on. You can leave it blank, or at least I've opened the door down the road of like, I know I can talk about this.
Yeah.
It's a safe environment, you know, to bring this up. And I think that's so important of just normalizing of like, this is something we can talk about.
Well, this has been, I think, really, really insightful, a tremendous amount of fun. And I mean that, you know, sincerely, you know, this is the first time that we've actually spoken to each other. We've met before, shaken the hands, right? But this right here, what you're hearing, people, right now, has been our first time pretty much ever talking. And while I think we're all very open people, I can tell you from my experience just now, and I'm sure you've heard it here as well, the two of these doctors right here, the two of these people do such a great job of making you feel extremely comfortable with sometimes the most taboo and most awkward things, right? And it's just testament to how fantastic they are. So Dr. Kelly Frank, Dr. Leslie Worth, I have just one more question to ask you. How legit is Dr. Ruth?
She's legit. It just go back to with anything of I think she's a pioneer of just breaking.
Because we all watched her, right? It was either like, you know, like the censored, you know, gone wild stuff, or as Dr. Ruth. You know, I wanted to learn. You know,
no, Dr. Ruth's amazing. She's such a pioneer in the sex therapy world of just. She was like the first one to kind of really just normalize it and I think it was even more powerful of like she was a little grandmother lady, you know, like you know,
not what you expected,
not what you're expecting
to hear.
Like I half expected like Robin Williams to take the mask off, you know, I'm like it's been me the whole time.
But no, she did so much, and we still have more to do, but she definitely was a pioneer.
Yeah, just open the door for more people to
ask
put
questions,
information out there. Yeah, ask questions, not feel ashamed or nervous or scared. Yeah.
Excellent. Well, I'll tell you what, again, thank you all so much for spending time with me today, allowing me to be a part of this production here. I learned a lot, and I think a lot of people out there that are listening to this, you've learned a lot as well. You definitely felt the good vibes. That goes without saying. So I guess that was the second to last question. This is my last question. How do people get in touch with you? You know, whether they're curious, you know, and maybe the B part of that, when do people get in touch with you? Would it be like right now, even if they feel like things are going well, or you know, when are some milestones or some things like, you know, like Jeff Foxworthy does that? You might be a redneck. Well, you might need sex therapy, or you might need some pelvic floor tune-up if you know fill in the blank with some of those things for me, and then do a nice little sign off of his how people can get in touch with you.
Yeah, anytime really. It's I think with sexual development, sometimes people just come in and they start asking questions, they start exploring. If you're in a new relationship, if you're in an old relationship, that's where I go back to. It's like it's really any time, because life is always changing. Obviously, if you're having real concerns or issues, definitely don't wait any longer if you don't need to. But any time is the right time, and I think it's easy. My work is easier if you come in when it's just starting to be an issue, or not even a non-issue. You're just like, I want to learn more, versus undoing a lot of shame or guilt or resentment or whatever to even get to the issue that you're wanting to explore. Mm-hmm. To get a hold of me, my website's worthwhiletherapy.com. That's the easiest way to get a hold of me. You can also find me on Psychology Today under Leslie Worth, which is a great resource to find therapists. You can sort by insurance and a bunch of other things. So those are the two main ways to get a hold of me.
Excellent.
Yeah. I would say, when to call your pelvic floor physical therapist or seek out pelvic therapy is kind of the same thing. Anytime, because we are going to kind of go through these changes in life. I love getting, I want to call it a baseline with people, before we go through some part of our life. Typically that might be a pregnancy or postpartum. But again, it could be starting new relationships. It could just be that, you just want to know more about yourself. Mm-hmm. But definitely the time to call is if you are that person at 2 a.m., Googling, is it normal for me to blank, blank, blank?
Exactly.
And that is the moment that you're that's probably not normal and I should call somebody. And probably is going to be a pelvic floor physical therapist.
Yeah, I like that. Yeah. That's a good frame of reference. If you're Googling it, is this normal, you should probably call somebody.
You should probably call anybody. Yeah. I mean, whoever that, maybe Google will tell you the type of provider, what kind of physician or therapist or, whatever it is. Mm-hmm. But yeah, I mean, the pelvic floor affects every aspect of our body. And it's just awesome to treat. And then to find me, so Dr. Kelly Frank, and I'm at franklypelvic.com. And then I also have my Instagram, which is franklypelvic. But yeah, we chose really awesome
seriously, that is phenomenal. I mean, that is top shelf, A+, best in class social handles there.
Yeah.
Love that. Well, thank you all so much again for being, who you are as individuals, as professionals, and spending time with all of us today. I know you helped a lot of people. All right. So everyone that's watching this and listening to this, I've been Dan Pacheco, and I appreciate you guys very much. We'll see you next time. Bye-bye.